Hello, everyone, and welcome to our discussion today around COVID vaccination education and the vaccine's rollout among Chicago's homeless population. Thank you for joining us for another discussion on Facebook and YouTube with the Night Ministry. My name is Ted Peso, and I'm the Director of Strategic Partnerships at the Night Ministry. Participating in our discussion today, we have Dr. Claudia Beals, a member of our board of directors and an emergency room physician. Dr. Beals has practiced for more than 10 years at hospitals in Chicago and the Northwest Indiana area. I'm also joined by two of my colleagues at the Night Ministry, Felitha Jones-Patterson, who is the Assistant Director of Early Intervention Services in the Night Ministry's youth programs, and Mary Poliwka, the Night Ministry's Community Health Manager. For those of you who are not familiar with the Night Ministry, we provide housing, healthcare, and human connection to members of our community who are struggling with homelessness and poverty. Because individuals experiencing homelessness, housing instability, and poverty are vulnerable to a multitude of health challenges, including COVID-19, prioritizing them for coronavirus vaccinations is essential to save lives and stop the spread of the disease. So today we have some questions to get our discussion started, but if you have questions for our panelists, please put them in the chat and we'll have time to address them a little bit later. So I want to start with Dr. Beals. Dr. Beals, could you talk a little bit about the different types of COVID vaccines that are available and their effectiveness?
All right, so far in the US, you have the Pfizer and you have Moderna. Those two are considered messenger RNA vaccines. And then recently you just had Johnson & Johnson, which is more of a vector vaccine that was just recently approved for emergency use authorization by the FDA. So the Moderna and the Pfizer uses the messenger RNA that is packaged in like a lipid particle. It enters the body through the injection, goes into the cell. It does not enter the nucleus of the cell, just enters the cytoplasm, and it binds with the ribosomes. The ribosomes' job is to make proteins. So at that point, you make the spike protein, which is what the messenger RNA that is packaged in the lipo particle. That's what we wanted to get to. That's the part of the virus that's on top of the virus that attaches to the cell. So at that point, it makes proteins that which makes this spike protein, and the body reacts to it. It notices it, and it starts to make antibodies against this spike protein. So with the Johnson & Johnson one, it's more of a vector vaccine, and it is combined with they call it an adenovirus, but it's not active, and that also goes into the cell, but that actually goes into the nucleus of the cell because it's more of a DNA virus, and from there it makes the RNA, goes out of the nucleus, it goes into the cytoplasm, and again makes the ribosome and makes the spike protein, and again the body reacts, creates its immune response.
And then how effective are the vaccines?
So Moderna and Pfizer are 94 to 97% effective. I think Pfizer just said that they're more like 97% today. It looks like Israel is pretty much have like 50% of their population vaccinated right now. And so they just came out with a study saying that like 97% is effective against the symptomatic disease. So, and 94% effective against asymptomatic disease. And that's the Pfizer. With the Moderna, you have 95% effective against symptomatic disease.
And then Johnson & Johnson?
So Johnson & Johnson, so with their study, they looked at mainly severe to moderate disease. So their study is a little different. So with them in the US, is 72% effective at day 14. And that effectiveness goes up to 100% effectiveness in 49 days against moderate and severe disease. So no one is dying 100% effectiveness at 49 days. And all of them, all three vaccines is preventing death, 100% effective against death.
Great. So yeah, I think that's really important to note is that we have three vaccines that may have different efficacy rates, but they're all really successful vaccines at preventing that, severe illness and death, right? And that's what's most important. So what are some of the differences between this vaccine and the vaccine that we receive, when we're growing up as kids, right? I think we've heard a lot from folks that this is something different. It's way different than the vaccines we receive. Is there any real difference there?
So this messenger RNA vaccine, it's kind of been around. So like I would say, like since maybe the 90s, you've had this messenger RNA. And maybe since 78 is when you start to have 1978, when you start to see like a lipid particle. So in the early 2000s is when they started to combine them to fight viruses. So it's new in that sense. So what we were used to as children, you had more of either a live attenuated vaccine, meaning that it did not have any virulence to it. It was not able to cause any infection. But you would have a response, your body would respond to it, versus a dead vaccine or inactivated vaccine. Again, your body would respond to it once it was injected into you. And with the dead vaccine, you also need an adjuvant as well to cause the response. So with the messenger RNA, you do not need an adjuvant. You don't need any preservatives. Because the body is going to respond to the protein once it's made. So you don't need anything to kickstart that.
Great, thank you. And so what are some of the side effects that are being reported from the vaccine? And how does that compare to really what you would experience if you contracted COVID-19?
Okay. So the main thing we're seeing is just a sore arm. After getting the vaccine, after I got the vaccine, I did have a sore arm for maybe a half a day. Most people say they have it for maybe 2 or 3 days. You may have some muscle aches. Some people have had headaches. That's the main thing. Fever, 2 or 3 days afterwards.
So in comparison to actually contracting COVID-19, the side effects are from getting the vaccine are much simpler, right?
Yeah, unless you want to come into the ER 4 or 5 days after getting the after getting the virus, and short of breath, chest pain, maybe needed to be intubated. Yeah, I'll say it's a good trade-off.
Definitely. And so when we talk about trust of the vaccine, can you talk a little bit about why, from your standpoint, we should trust this vaccine?
Just looking at the data, it looks like it's pretty safe. Again, does not have the preservatives that people talk about that they're concerned about. This is more of a natural response that your body will have anytime you are you receive something that it is not aware of. This is how it's going to respond. This is more natural.
Great. And so once somebody receives the vaccine, should they still be wearing masks, practicing social distancing, and taking all those precautions that we've become used to over the last year?
So with the Moderna and the Pfizer, you need two shots. And so before you be considered fully vaccinated. And again, it's only really telling you that you're vaccinated against symptomatic disease. So you can still have asymptomatic, you can still shed the virus. So you still want to make sure you're wearing a mask to prevent any shedding, to prevent you from spreading it to someone who may not be vaccinated, or someone who's older or who cannot be vaccinated.
Great. Yeah, that's important information to know. So I want to bring in Felitha and Mary. Can you both talk a little bit about what concerns you've heard from some of our patients at our outreach and health program or in our youth shelters, some of our clients? And then I'm hoping that Dr. Beals can kind of correct some of that misinformation for us?
Absolutely. Well, hi everyone. My name's Mary, and I'm the community health manager at the Night Ministry. So I primarily work with the health outreach class in our street medicine program. So in our street outreach program, when we've been offering the vaccine, most people are a strong, enthusiastic yes or a strong, enthusiastic no. And the folks that are really concerned about the vaccine, for the most part, say one of two things. One is that they're scared there may be a poison or a microchip or something harmful inside the vaccine. And the other big one we're hearing is, this vaccine was just developed a little too fast. I don't trust it. What's going on?
Great. Thanks, Mary. Dr. Beals, what about that, the virus was, or the vaccine was developed too fast? Can you talk a little bit about that?
Okay, so yeah, most times vaccines will take years to develop. Again, the messenger RNA has been around since the 90s. This vaccine, this virus is actually able to be cloned because, it's part of the coronavirus. So it's been cloned. So it's not like something that's, brand new. No one knows anything at all about it. So the genetic code is already in place. So it was easier to come up with a messenger RNA because it was already been coded. So only thing that was really maybe a little faster is just the manufacturing of it. But other than that, like I said, the messenger RNA has been around, the science has been around for, probably close to 30 years.
Yeah. So we have a vaccine that's based in science and that's been approved and researched and everything. That's
right.
Good to know. Felitha, what about you? What are some young people saying in the shelters?
Sure, Ted. Hi, I'm Felitha Jones-Patterson, and I'm an assistant director of early intervention youth service programs with the Night Ministry. And what we've seen in our shelter programs amongst young people, the conversations are, one is typically surrounding the fact that the side effects, potentially the side effects to the vaccination doesn't make sense for them when many of that age group have been asymptomatic in their, so they're like, why would we make ourselves sick? So the ongoing question comes to say, why would we potentially make ourselves sick to prevent ourselves from getting sick? So that's one of the things that I've noticed young people are really saying. And
Dr. Beals.
Adults are saying that as well. Like, I haven't got coronavirus and it's been a year. So they are really playing a dice roll on maybe not contracting and waiting for like herd immunity.
Dr. Beals, how would you respond to that?
So yeah, I was lucky not to get it as well. I was, around it quite often, intubating people, even young people, who felt the same way that, hey, I'm not going to get sick, and I've had to intubate a few of them. You still have to worry about the inflammatory response that you get from this disease, young and old, that people coming up with blood clots in the lungs and the legs, losing limbs, even young people. And you still have to worry about, even though you're asymptomatic, you can still, give the disease to someone else who, who's older, who may have comorbidities, and they can get really sick and die. So that was my big thing. It's like, I have not had it, but at the same time, I may need to be around my mom. And so, I could be asymptomatic, but will I affect her? Would I, cause her any problems? So, that was a really big thing for me.
Great. Yeah. Can we talk a little bit about distrust of the medical system? We work with people who are experiencing homelessness who sometimes have complicated relationships with the traditional healthcare system. We also know that there are some historical implications of communities of color and how they may trust the medical system and the vaccine system that's out there. Does anybody care to comment on any of that? Is that something we're seeing in our programs at all?
Sure. I think I wanted to add the fact that a lot of distrust amongst the Black community has been a very, very, very critical part of them not, or us and and my group not taking the opportunities to get vaccinated sooner, because there are some with the historical references to things that have happened that made us distrust the healthcare systems, and not trusting that the vaccine is not another, from what I've understood people to say, is that it may be a ploy to cause harm to other folks in the Black community, to be quite honest.
Mm-hmm. So is there any strategies that we can employ to get past that, or any ideas about how to address those concerns? That's open to anyone.
I think in the health outreach programs, what has been really critical is the relationship building of the work that we do. We are seeing that a lot. Again, we ask people, are they interested in getting the vaccine? And a bunch of folks will just say, like, no, I don't want that. I'm not interested. And there's actually some kind of, you can tell it brings up some negative emotions, and they don't even really want to talk about it. So the fact that we've been working in these sites and working with these individuals for so long, people are more willing to engage with us and have more open conversations about what the vaccine, what it's all about, and why they should trust it. And I think that's been really instrumental in our efforts so far.
That's really great. Yeah, I think we've always said that the importance of that human connection piece that we provide at the Night Ministry is like building that relationship and that trust, and then using that as a conduit for deeper services. And I think that this is somewhere where this can be really employed, right?
Yeah.
Okay, so
I'm sorry, just trusting science, right? I think that's something that we have to embrace. I was able to get fully vaccinated with both the first and second dose, and watch other folks do it and be fine. So I think some of the myths can be dispelled by having more people sign up to get vaccinated, and to not only lean on just hearsay about what could happen, but folks that have really gone through that experience and are fine with getting the vaccination.
Yeah, that's a great point. I was sharing with everyone here a little bit earlier that a colleague in California mentioned helping clients get to the slow yes. So kind of acquiring information, observing, and then when they become comfortable to accept the vaccine, supporting them in that. So I thought that was a really beautiful way to say it, that slow yes, right? I just want to take a moment to remind people who are watching that you can enter some of your own questions in the comment section, and we'll get to those in just a few minutes. So back to some of the questions we have prepared for today. So Mary and Felitha, why is it important for communities like Chicago to prioritize individuals experiencing homelessness or housing instability when they distribute their vaccine?
Yeah, so I can jump in on that. It's important to prioritize our clients experiencing homelessness because they're already more vulnerable to poor health outcomes just by the fact that they're unhoused. Moreover, we have a lot of clients that are older. We have a lot of people with pre-existing health conditions. Our clients tend not to have regular access to medical care. So that could mean they're not getting tested if they're symptomatic. It could also mean they're not getting treatment if they're symptomatic. Our clients may not have access to PPE. We've been trying really hard through our outreach programs to make sure everyone has masks that they need, gloves, any other items. Hand sanitizer is a big one, but they may not be able to access those things regularly in their normal life. And then we have to look at the congregate setting versus living outside. If our clients are in congregate settings, then they may not be able to socially distance. And obviously that proximity to others may increase transmission. On the flip side, if you have clients that are living outside, they can probably social distance pretty well, but they have to deal with the elements, and maybe the snow and the cold and the rain impacts their health. Our clients also may not have regular access to bathrooms and showers and ways to maintain optimal hygiene, which could also negatively impact their health and make them more vulnerable.
Wonderful, yeah. Felitha, are you seeing any specific things in the shelters besides what Mary mentioned that require us to prioritize folks?
Absolutely. I mean, it's a transient population, and oftentimes, especially with the young people, they have been couch surfing and living place to place, maybe night by night. So you are not with the same nucleus of people, so that your chances of spreading or contracting COVID-19 are put at more risk because you are in a shared spaces, even when you come to shelter programs, because we have congregate living situations, but those that are finding themselves unstably housed are leaning and depending on staying with some people, oftentimes different night by night. So it's going to be really important that they take all the precautions that they can at this point.
Definitely. Mary, what barriers exist among the folks that we serve that make it more difficult to access a vaccine?
Yeah. So first of all, as we've been talking a lot about, I think misinformation is a huge problem that prevents people from wanting to pursue the vaccine at all. But then also, as we discussed, there's the general mistrust of the medical system. A lot of our clients have had traumatic experiences in the ER or just at regular clinics. They haven't been treated with respect. And for that reason, they do not want to go. We also just have the general problem of it's hard to get a vaccine appointment. It's been hard. It's hard for people who have lots of resources. So we have clients that don't have phones. They don't have computers. They may not be able to just use the normal routes that people are using to get vaccines. So they don't even know where to get it. And then there's also transportation barriers. Do they have a bus card? Do they have a car? Are they able to get to an appointment? So the night ministry and being able to bring those services and the vaccine directly to clients has been really helpful in kind of mitigating some of those barriers, because there are so many. It's really challenging for folks out there.
Definitely. So for both Mary and Felitha, can you talk a little bit about then how we are rolling out the vaccine in our programs and kind of what we're doing specifically in our youth programs for education around the vaccine?
Absolutely. So I can talk a little bit first about the Outreach and Health Ministry. Our vaccination efforts have been pretty successful. We've been vaccinating now for about a month with our street outreach. Again, I think the relationship building component has been the most critical in making sure this is happening, but also the fact that, again, people don't have to really travel to us. We're bringing the vaccine to them. No one has to make an appointment. No one has to bring any special documentation. They already know us. They can talk to our providers about what the vaccine is all about and is it safe. We're also able to do things like provide masks and provide sanitizer and those creature comforts that throughout the pandemic have helped people comfortable around our staff and know that we're there to help them during this time. I'd say the biggest challenge has just been that the vaccine comes in multi-dose vials and we have to use them within a short time frame. And since our population is so transient, it can be hard to locate folks in the amount of time we have. But we've been really strategic about it, utilizing all of our different programs, and overall have been very successful. It's been really exciting.
Great. And Felitha, in youth programs, what kind of education are you providing to young people or sharing with young people to kind of help with this effort?
Given that, information is coming out like minute by minute as it relates to COVID-19 and the vaccination. So what we were able to do is we were going program to program in real time, offering a presentation and also a Q&A so that young people could actually ask questions of concern, or where do we get information? How do I look for credible sources? And also giving them a platform to address all the questions that they may have had that prevents them from swaying whether or not they wanted to get vaccinated or not. So definitely going program to program and making sure that everyone had real resources and also good information, because I think misinformation has been a culprit, but we've been able to share and educate young folks about what safety precautions and what is facts and what are based in science and what is not.
Yeah, we really have seen that throughout the pandemic, right? That misinformation campaign. I remember early on in the pandemic, like the first week, somebody had mentioned to me that the COVID virus was like a mix of all these different diseases, and right away we knew then early that we were going to have to do some education for our clients about that, and that's continued throughout the entire year now. So I want to go to kind of vaccine testimonials. We've heard that that's one way to kind of get people to trust the vaccine and the experience. Dr. Beals shared a little bit about her experience and her motivation for getting the vaccine. Felitha and Mary, could you kind of share some of your motivation or experience?
Well, I can go. I'm sorry, Mary. Well, what I was going to say is just in the same way that young people have gotten information that are misinformation, I was getting that same information, right? So you hear a lot of they said, and I'm like, who are they and why are they so credible, right? So I took upon myself to make sure that I did the research to make sure that I educated myself as well. And the night ministry has done a wonderful job with sharing resources to us at no avail. But there was some apprehensive, even as I got into the line, because this is a new thing that we're all embarking on. And as I saw lines of people lining up to get vaccinated, or in the first group of the 1B group that I've been honored to be in, actually, and I'm racing to the line, and I watch people actually get it. It kind of gave me some encouragement to be able to say I can do this as well. And so after getting my first vaccination, I was like waiting in like, okay, what's going to happen? We wait a little 15-minute break afterwards, and really I was lucky enough to only have a soreness in the arm maybe for a day. Even with the second shot, I think the second shot also placed another level of stress, because people were like, it's not the first one, it's the second one. And I was thinking, like, if it's going to take us out, like, why haven't we heard like all these people have died because they got the vaccination, right? And then that has not occurred. So it was really a lot of prayer in the second shot, to be honest. And I got in line and I got it. And again, I had a sore arm, and I woke up thinking like, okay, am I going to have any more symptoms? And I didn't. And I do know that folks have said like I was a little more achy than usual, but that was my experience. So I'm lucky in that way. Mary?
Yeah, I took a similar approach to Felitha. I definitely did my research as well. Watched a number of webinars and read the CDC websites. I think that's really important. But overall, my motivation was to see my family, see my friends. I've only gotten the first dose of the vaccine so far. And for me, I think there was some arm soreness. I was a little bit tired. It was no big deal. But, when I got it, I was with some others that were also getting it. People were cheering. Everyone was so excited. And just the enthusiasm in the room was just wonderful to be a part of. I think the future of what it means to be vaccinated is so exciting to me. And I really look forward to all it brings. And I hope that other people feel the same.
Yeah, I heard one of our colleagues today say that this is that he thinks this is the biggest medical breakthrough of his life, and the impact it's going to have on the world. And it's really something to hear that, right? Very similar experiences for me. I've had one shot, just a sore arm, and I did it basically because I want to be around my friends and their kids more, right? And also, I think to be an example to the folks that we serve, the young people that we serve, that I get to see throughout the week, to encourage them when it's their chance to go ahead and get the vaccine as well.
Yeah.
So
seriously, Ted, I was just going to add that the numbers of people who lost their lives, I just wanted to make sure I did my part, to at least try to make an attempt to not have that number continuously increase in astronomical ways. So, I wanted to add that, because that has been very hard on all of us.
Yeah, thank you for saying that.
You have to worry. That's now another variant. There's other variants out, and so if people don't get vaccinated, it's going to continue to mutate. And so the thing about the Johnson vaccine is that it was that study did include people who had the variant. So that has the strongest evidence as far as having some effects against the variant.
That's good to know. Yeah, definitely good to know. So I'm not seeing any comments or questions. So I think we can go ahead and wrap up today. I want to thank Dr. Beals, Felitha, and Mary for sharing their knowledge and experience with us. And thank you to everyone who's watching here today on Facebook and YouTube. Be safe, everyone. Thanks again. Have a good night.
Bye.